Today on Shine, we have Dr. Nicole Sommer, who is actually a plastic surgeon extraordinaire. You're a plastic surgeon extraordinaire. And we wanted to kind of continue with our theme of breast reconstruction after breast cancer. And I guess the first thing I want to ask you is, I mean, you do a lot of different types of procedures. So what is so special about the breast reconstruction that's different from some of the other procedures that you do?
Well, breast reconstruction is obviously taking someone who's had either a full mastectomy or a partial mastectomy, so they've had a part of their body removed or a portion of their body removed, and it's reconstructing, it's trying to bring them back to a whole person. So it's obviously, it's going to be, you know, basically taking someone who has had treatment for cancer, and it's sort of what we say in broad day, which is, you know, closing the loop on breast cancer. It's basically finishing that journey for them. So, you know, and breast reconstruction isn't necessarily something that everyone chooses to do. It may not be the best, the right option for everyone. But for a lot of women, it is the best option. They want to try to feel as whole again as they can, and with not having a breast, it's hard for them to feel that way.
Do you think women, I mean, obviously you get the shock of cancer, right? And then you're going through that surgery, like you said, basically taking off a body part. Do you think that they're prepared for what that's going to look like and feel like afterwards?
No, and I mean, I think it's hard for them to ever really truly be prepared. You know, years ago, breast reconstruction never was done at the same time that someone had a mastectomy. It was done later after they determined that they were free from cancer. Back when treatment was very different for breast cancer. And it's actually interesting because if you talk to some older plastic surgeons, they'll explain how the patients now are very different than they used to be, because they used to be a situation where they got used to not having a breast. They sort of came to terms with that. And so then when they went through breast reconstruction, they were all just ecstatic to be able to have something that sort of resembled a breast again. And it's different now, because now women can potentially wake up and already have the breast reconstructed, so never have actually gone through that phase. They can have the mastectomy. Some reconstructions we can do immediately on the table, and so they wake up never really having even seen themselves without a breast. But I always try to, because of that, I always try to explain to patients that, you know, breast reconstruction, I want them to have very realistic expectations. We do our best to try to make it as much like a normal breast as we possibly can, but there are just limitations in what we can do. And so that's really important to educate patients about, because I think sometimes they just don't understand that. They kind of expect to wake up and it look like their other breast, or it look like the breast that they just lost, and that's not necessarily going to be the case. There are going to be adjustments that are going to have to be made, or potentially surgery on the other side to make them more similar. That's very common.
I mean, as a female, I mean, that's just part of our femininity, right? What do you see in the patients that have to maybe wait for their reconstruction, or even the ones who don't decide? Is there a difference in their emotional healing? I mean, when you follow up with those women?
I think in some respects, like I said earlier, they're more thankful in some ways, because they've lived through not having a breast at all. And so to them, you know, the limitations that we sometimes have with breast reconstruction, they don't even notice those limitations, because for them it's so much better than what they had. They had nothing. So in some respects, I think it's almost easier for them to go through the reconstructive process. Now, I don't know how easy it was for them to deal with it up until that point, because they were living without a breast for all that time. But as far as the reconstructive process, I almost think sometimes it's easier for them, because they're just so excited about finishing that off.
And, you know, how did you get hooked up with Jason Lee? Like, we've had the video, you know, just kind of not only helping after your surgery, but almost even still helping it look like a normal breast. So how did you get hooked up with him?
We, as plastic surgeons, we make the mound for the breast, and then we reconstruct a nipple and an areola. And there are lots of different ways to do it. We can do that by making a nipple just by the skin that's right there. We can recreate a nipple, and then a lot of times we'll either, to make the areola, we'll either use a skin graft for that, or we'll tattoo it. And so we've as plastic surgeons, we've tattooed a long time, but we weren't really doing any kind of 3D tattooing. We weren't, you know, we weren't artists in that respect like Jason is. So we were doing the best we could, and then we started hearing about people throughout the country doing 3D tattooing. These are actually tattoo artists that are doing this for people with breast reconstruction. So we started looking into it and deciding, well, maybe we should start trying to do some. So we were dabbling in trying to do some 3D. Because a lot of times patients really want to have it done at the office. They don't really want to go to a tattoo artist. Because I've told them for years, I mean, ever since I've been in practice for 15 years, I've said, go to the local tattoo parlor. We know them. They're nice people. They'll do a great job. This is what they do. But a lot of times patients didn't want to do that. They chose not to.
Well, and even though they may not have what they feel like is a normal breast, there's still that probably exposure aspect.
Yeah, right. They just
not feeling comfortable.
Just walking into a tattoo parlor, they just didn't feel comfortable with it. So then anyway, we kind of had been dabbling in it, and then we had one resident who was very into it, and he had met Jason, or I think through Jason's wife or something. They had met and they talked, and so then he basically brought, and I think Jason talks about this, he basically brought Jason to one of our conferences so he could teach us how to do it. And so we're watching him, and we have a couple patients, and he demonstrates it on us, demonstrates for us, and it was great. But then as I'm standing there, it took him an hour to do this, and he does this every day, and he did a beautiful job. And I thought, it doesn't matter how much I learn, I'm never going to be able to match this kind of skill. I mean, I just don't do this every day. I don't tattoo. I'm never going to match that. I said, so why are we even trying? Why don't we just figure out a way to get him to do it? And so the barrier, once again, was if he did it at his place, because he at this point was already willing to do it for free for people. So that wasn't the barrier. The barrier was still, do they feel comfortable going there? So then we decided to work it out with the school that we could purchase some supplies for him, and he could come in and do it for free still, but just do it in our office so people feel more comfortable.
Right, and even so, like you talked about, that's not something that insurance pays for. I mean, that's not
for tattooing. They pay for it. They pay for it if I do it. If I do the tattoo, which is really cruddy. Not nearly.
That's very interesting.
Well, because it's part of there's nipple reconstruction as part of breast reconstruction, and so if I did a 3D tattoo, they would reimburse me for it, but I just am never going to be able to have the quality that he has. So it was just, this I thought was a better option for patients.
And I just want to say, I think that's something to be said about Dr. Sommer. She wants to give her patients the best possible result. Sorry, person behind the camera.
No, you're good. We love it. Thank you, Maria. Because part of it is if you're going to be looking in the mirror for the rest of your life, you want it to look as real and natural as possible. And so that's something that he's able to provide that maybe your artwork wasn't going to be able to do. So that's really important. And part of the reason why we're talking about this is we're trying to help, Jason does this for free, and we're trying to help raise some of the supplies that he may need in his office for women who may choose to undergo the repigmentation because insurance doesn't pay for him to do it. So, I mean, life-changing for most women. So you get to see the women maybe when they come in on the days that he does his work. I mean, are you still in awe of
the
what
results?
He can,
they're impressive. They're really impressive. Yeah.
Sometimes even maybe looking a little bit better than the real thing.
Well, I don't know. I mean, obviously, it's still just 3D. It's not it's flat,
but it's perfect.
It's amazing.
But it's perfect.
It's amazing. I mean, and we've had. And I don't remember if it was Jason, but because we'd all had worked before Jason, we'd worked with another tattoo artist a little bit, and he had done some for us, and and I'm just thinking, because I'm thinking of a unilateral where you're actually matching it to a normal nipple. That's when it's really impressive, when you look at them and you're far enough away that you can't tell if it's flat, that you're like, which one of those is real?
That's amazing.
It's because if you cannot figure out which one actually has some depth to it, because it looks.
Right. So what happens to the women who don't go through breast reconstruction? I mean, is that something that's readdressed every year, or does anybody follow up with them?
Well, I mean, their general surgeon follows up with them for a while, and then obviously their oncologist does if they have further treatment, ongoing treatment. It's one of those things where I'll meet with some women and I'll explain to them the options, and they're saying, I'm not really sure I want to do this. And I'm like, you don't have to. This is totally your choice. Some people are perfectly happy just with a prosthesis and a bra. But if that gets annoying, which sometimes it can for people, although the bras are so much better than they used to be. They're much better. I mean, early on, they were, the prostheses were flying out. I think they've improved greatly. So
Right.
people have a lot less issues than they used to. But sometimes they get hot or they get really heavy, and so they get tired of it. I'm like, if you ever get tired of it and want it, just come back. I mean, there's no limitation on when you
That's
can
what I was
come
gonna
back.
ask you, there's no statute of limitations
well,
on your reconstruction?
So, there's a law that states that all reconstructive surgery after a mastectomy has to be covered by insurance, and
Right.
any matching procedure to the opposite normal breast has to be covered. So,
Mm-hmm.
and for a while, early on in practice, there were some insurance companies that were trying to kind of set a limit on it, like a 2-year limit. But just in the last 5 years, I have just not seen that be an issue.
That's amazing.
So I don't know if that, that's not like written into the law, but I don't know if insurance companies have realized that's a, not such a nice thing to do, is try to put limitations on
Right.
people. But I have not run into that issue recently,
Okay.
like I did early on in practice.
Because if you're just not emotionally ready,
Right.
it may take you some years.
Right.
So you would still have the option
Yes.
to come back and do
Yes.
that. That's incredible. All right, anything else you want to tell us about breast reconstruction awareness or?
Well, I just think, the whole point of our breast reconstruction awareness is that there are a lot of women that don't even know about the option for breast reconstruction. And I'm talking a lot. Over, what is it, like, I think it's like 30%.
Yeah, it's
Or
a
only
lot.
30%, no, only
At the
30%
time-
know
at the time of the
about it. That
mastectomy.
means like 77% don't know about it.
That's an option.
Yeah, so that's huge. That's a large number for people not to know. Sometimes it can do because they live in a town that maybe just has a general surgeon and doesn't have a plastic surgeon, and so they're not told about it. And the important thing is just for women to know it's an option, because say you're in a small town
And it's covered.
and it's covered. That's the other thing, is for them to know. But the problem is that all the doctors pretty much, well, all plastic surgeons, and I would hope most of the general surgeons, know that it's covered. It's just that it's, if you live in a town where there's only a general surgeon, maybe you're gonna stay there just to have the general surgeon do it, but it may be if that general surgeon told you, hey, we don't do reconstruction here, but you could have it done if you go somewhere else, and I can refer you to another general surgeon to do the mastectomy, and then they'll do,
Right.
then that patient has another option.
Right.
But there's a little bit of resistance to do that, 'cause,
And breast reconstruction day is Thursday.
it's
No, it's
tomorrow.
Tomorrow. Oh, it is. What's the date?
October 17th. It's always the third Wednesday of the month in
Okay.
October. And we just found out that we had a proclamation from the governor.
We should have
to
brought
make
it in to show it from Governor Ronner,
Yeah,
right?
that tomorrow, proclaiming that tomorrow is Breast Reconstruction Awareness Day in
That's
Illinois.
awesome, because you guys have done a lot of work with that.
We have,
With the
every
School of
year we've been
Medicine.
involved in Bra Day, a national Bra Day. SIU's been involved, and that's been mostly because of Maria.
Maria, come around the side, Maria, so everybody can see you. Sure.
I can bring the proclamation.
Hello,
Yep, there's Maria. Yay! Who actually, Maria was very integral in getting all of us together, even Jason. And then, as you guys saw the Survivor interview, she was the one that was doing the video while I was on FaceTime.
Oh,
interviewing.
right, yes,
Yeah.
yes.
So we appreciate that. And we're actually going to have another fundraiser next Thursday at Papo's Cafe. You'll be hearing a little bit more about that, 5 to 7. All the proceeds from that fundraiser will go directly to the supplies for Jason to be able to perform the repigmentation, the revision of the scars and different things that he does for women who are kind of in their final stages. So we'd appreciate everybody coming out. Yeah, this was awesome. Thanks.
Yeah,
Yeah,
thank you.
she's my surgeon, so I get to chum up a little bit, right? All right.